Good evening. I'm Dr. Gail Wynn, and I'm going to be talking about whether weight loss surgery is right for you. I am a founder of the Christiana Institute of Advanced Surgery, where we have been doing weight loss surgery in northern Delaware for almost 20 years. And I'm in private practice, general surgeon, and along with Dr. Ergau, Dr. Peters, Dr. Abraham, and Dr. Singh, we do a large amount of weight loss surgery, and we're the most experienced in weight loss surgery in Delaware. So thank you for joining CHRIAS Goes Live. We'll talk about how do you know if weight loss surgery is right for you. When we talk about weight loss surgery and we think about it, oftentimes we are met by other people that might have had weight loss surgery. You look at them and you think, wow, you look fantastic. You've lost so much weight. What did you do? And they tell you, I've lost weight via weight loss surgery. Sometimes it might be your primary care doctor that kind of gives you a hint like, hey, maybe you need to start thinking about weight loss surgery. Well, whether you've heard it from a friend, whether you've heard it from your primary care doctor, I always say when you think about weight loss surgery and whether this is something that it's time for you to tackle, you kind of have to ask yourself some questions. So number one, are you tired all the time? Are you not able to do the things that you enjoy? Number two, are you starting to have health issues, or have you been having health issues? Things like diabetes, high blood pressure, sleep apnea, joint pain, back pain, infertility issues, frequent morning headaches. Believe it or not, all these things are weight related. Number three, are you miserable in your own skin? Does your back hurt? Do your joints hurt? Does things like walking make you ache and make you short of breath? Number four, do you have depression or anxiety because of your weight? You don't want to go out anymore. You don't want to be seen in pictures. You don't want to go out with friends. Number five, have you tried to lose weight in the past and you've failed? And every single time you try, you actually gain more weight. We call that the yo-yo diet. Number six, are you committed to a lifestyle of change? If you could say yes to 3 or more of these questions, then you may be a candidate for weight loss surgery. Weight loss surgery is a tool to help you lose weight. It's not a miracle cure. The whole goal of weight loss surgery is to make you have a smaller stomach so that you eat less. It helps you get control of your hunger, but it also helps you lose a significant amount of weight in the first year so that you can get your life back, so that you could move easier, so that your health issues go away. So, who's a candidate for weight loss surgery? Well, in order to be a candidate for weight loss surgery, you have to be at least 100 pounds overweight or at least 80 pounds overweight with medical problems like diabetes, high blood pressure, sleep apnea. You also have to have tried something in the past to lose weight and have failed. This cannot be your first attempt at losing weight. You also have to be willing to undergo a lifestyle change. What does that mean? Well, it means making better food choices, making better health choices, eating more wholesome, eating less processed foods, stop smoking, and also means to become more active. The next question may be, well, which surgery is even right for me? Well, there's 3 surgeries that we do: the gastric band, the gastric sleeve, and the gastric bypass. And when I approach these, I basically say, think about this as you think about the surgeries. Think about, what is your weight loss goal? That's first and foremost. Everyone wants to lose more weight, not less weight. Number 2 is, what is your health issues? Number 3 is, do you have acid reflux, and is it really bad? And number 4 is, how old are you? First, you gotta know what your weight loss goal is. If you only want to lose about 30 to 40 pounds in a band, it may be perfect for you. If you want to lose more like 50 to 75% of your excess weight, so if you're 100 pounds overweight, that means 50 to 75 pounds. If you're 200 pounds overweight, that's like anywhere from 100 to 150 pounds. So if you're thinking about something in that range, think about a gastric bypass or a gastric sleeve. When you think about, let's talk about the band a little bit. The band is a silicone band that goes around the upper stomach to help you lose weight. but it's adjusted with a port, and the port's buried underneath the skin, underneath the fat in your abdominal wall. And it's adjusted with a needle. So if you don't like needles, you probably should not get a band, because it does require you to get stuck with a needle in order to make it tighter or looser. The other thing about the band is it requires adjustments. So every 2 weeks till it's adjusted just right, you have to come to our office and get it adjusted. So if you have difficulty getting time off of work to come into our office, or your fear of going out because of COVID, you probably should consider another surgery other than the gastric band. The gastric band, though, is the only reversible surgery that we do. When you lose weight, lots of health issues go away. Diabetes, high blood pressure, sleep apnea. It makes your heart better. So weight loss surgery in and of itself will help you lose weight because you're going to lose weight. And it's also going to help you lose your medical problems. But specifically for the gastric bypass, sometimes diabetes goes away before you lose a significant amount of weight. If you have a problem called gastroparesis, the gastric bypass is a surgery for you. It helps cure gastroparesis. If you have something called Barrett's esophagus or really bad acid reflux, the gastric bypass is the better surgery for you. If you think about your age, I usually say if you are young, like 40 or below, or advanced age, 60 and above, you should think about gastric sleeve. The reason why is when you're advanced age, it's less surgery. If you are younger, say you have babies and each pregnancy you gain 25, 30 pounds, or something happens in your life that's very stressful and you gain weight back. We can't redo a sleeve, but we can change a sleeve to a gastric bypass. That's why I say if you're a younger age or if you're advanced age, you should think about the sleeve. I'm going to talk a little bit about the surgeries. The gastric bypass has been around since the 1950s. It's been perfected since the 1990s, and the bypass encompasses two things. It basically will make your stomach smaller so that you can't eat as much. And then we also bypass part of your intestines so you don't absorb as much as well. Because your absorption is altered, there's certain things that you have to do with a bypass. You have to make sure you have to eat enough protein, otherwise you can lose hair. You also have to make sure you take multivitamin, calcium, B12, and iron. You also have to avoid things like refined sugar, because that could give you something called dumping syndrome, where you get diarrhea, cramps, sometimes you get flush, sometimes you get really sweaty. If sugar is your weakness, though, gastric bypass is a great surgery because it will deter you from eating sweets. The most popular surgery that we do is the gastric sleeve. The gastric sleeve is basically where we take out about 80% of your stomach. And so now your stomach, that's normally about the size of a Nerf football, is the size of a medium banana. So you're limited in how much you can eat. Both surgeries help you lose a significant amount of weight. Like I said, about 50 to 80% of your excess weight. When you lose weight, medical problems go away. Diabetes, high blood pressure, sleep apnea, heart disease, joint pain, back pain, headaches. So all the surgeries that we do will help you lose weight and feel better about yourself, but also help get rid of your medical problems. With the gastric bypass and the gastric band, there's certain things that you have to do, like avoid aspirin or ibuprofen, because that can cause ulcers in your stomach, which can really be hard to heal, or it could cause erosion of the band. With the sleeve, aspirin or ibuprofen is actually okay. With a gastric bypass and a gastric band, it's also hard to take large pills, so you have to crush them or make sure that they're in liquid form. With a gastric sleeve, after about a month or so, you should be able to take large pills without any problem. All the surgeries that we do are done laparoscopically, which means through small incisions so that you heal rapidly and you're able to get up and move around pretty quickly, so it's rapid recovery. When we do these surgeries, they usually have about 5 small incisions, and we oftentimes do this in an outpatient setting at a surgery center, where you're going home in about 8 to 10 hours after surgery. The great thing about it, with COVID, you could avoid being in the hospital, and also you get to sleep in your own bed. Depending on your health, though, or your insurance, you may have to be done at the hospital with an overnight stay. Some people ask, well, with COVID, is this the right time to be pursuing surgery? I say absolutely. And the reason why is this. When you're overweight and you have multiple medical problems, you're at higher risk of having a really bad outcome if you catch COVID. So the better thing to do is lose weight now, get rid of your medical issues. Otherwise, you're going to be in that high-risk group, and we don't know when COVID is going away. We do try to make sure it's safe at this point. We test everyone for coronavirus before we actually do your surgery so that we don't put you at risk for things like heart attacks, strokes, pneumonia, or any complications that are related to COVID. When we look at all three surgeries have the same preoperative workup. So a sleeve workup is not faster than a bypass, and a band workup is not faster than any of those. All three surgeries require that you see a dietitian. You also have to see a psychologist. You also have to get clearance from your primary care doctor and oftentimes a cardiologist as well. We have you do blood work as well as get an endoscopy where we sedate you, put a scope down, look at your stomach to make sure your stomach is actually okay for surgery. And depending on your health, we may have you see other physicians to get clearances before you have weight loss surgery. If it sounds like you're at risk for sleep apnea, we also have you see a lung doctor as well. Once we get all these clearances, we take all the information, we submit it to your insurance to get it approved. Before surgery, everybody has to do the same pre-surgical diet, which is basically 2 weeks of protein shakes, protein bars, protein soups to shrink your liver to make it easier for us to do the surgery laparoscopically through the small incisions, and it also makes it safer to do the surgery. After surgery, everyone has to do the same postoperative diet, and that means 2 weeks of liquids. That could be creamed soups, that could be basically any drinks that could go through a straw, and then 2 weeks of mushy foods, things like tuna, refried beans, things like that, so that allows your stomach to heal properly. Regardless of your surgery, everybody has to do the same diet for a month. It's not as miserable actually as you think. So when you're thinking about weight loss surgery, you have to think about, well, which one is right for me? How much weight do I want to lose? And am I a candidate? Do I meet these criteria? If you have questions about this, I'll take this at any time. And if you're interested in weight loss surgery, you can also make an appointment with us in consultation so that we could review your history, get to know you better, and discuss whether weight loss surgery is right for you. At this point, I will take any questions. It looks like we have a question. Does diabetes make weight loss surgery riskier? And are there extra precautions to take? Absolutely not riskier. Diabetes actually is a great reason to have weight loss surgery because it helps it go away. The longer you've had diabetes, the more resistant it is to go away, and so the bypass may be a better surgery for you, especially if you have uncontrolled diabetes, which are on multiple medications. As far as riskier, because we do it through small incisions, the risk of infections are much less. It's less than 1% versus a big giant open incision. And as far as is there precautions to take, we do check your hemoglobin A1C to make sure it's less than 8 before surgery, because if it's greater than 8, then you're higher risk of things like strokes and blood clots. So we do want it corrected below 8, but we also know that by losing weight, it's going to help get rid of your diabetes. And another question we have is, how soon does a patient's chronic condition improve after weight loss surgery? It all depends on how fast you lose your weight. Things like back pain, joint pain, that can go away after the first 20 or 40 pounds lost. As far as high blood pressure, sleep apnea, diabetes. So with high blood pressure and sleep apnea goes away usually after you lose about 50% of your excess weight, which we set that goal around 6 months after surgery. As far as diabetes, same thing for a gastric sleeve, but if you're having a gastric bypass, because of the way your intestine is rerouted, sometimes diabetes goes away before you even start losing a significant amount of weight. So these things actually get much better as you lose weight. Another question is the surgery covered by insurance? It usually is, unless it's an exclusion in your policy because of your employer. Surgery is covered by Medicaids, Medicares, and private insurance. As a Blue Distinction and an Aetna Gold Star, if you have surgery through us, basically I think your copay is much less because you have it done through us. Another question is, how about pregnancy? Well, if you have difficulty getting pregnant, oftentimes weight loss surgery is the solution because it helps you lose weight so that you can actually get pregnant. And oftentimes that's one of the major reasons why we do surgery on someone. As far as after surgery, are you able to get pregnant, and is it safe to get pregnant? After surgery, as your hormones normalize, yes, it's very easy to get pregnant, but we ask that you wait till about a year, year and a half after surgery. And the reason why is you're going to lose weight that first year, and that's when it's going to be lost the most. You don't want to get pregnant during that time because you're not going to lose the weight that you wanted to, number one. But number two is you also want to be able to eat enough to maintain a healthy pregnancy. And that usually happens about a year after surgery. So you want to be careful. Use birth control that first year after surgery, and then after that, go ahead and get pregnant. Another question is, how long after a consultation would you be able to get surgery? It all depends on your insurance. Many insurances require that you see the dietitian for about 3 months, and to see the consults like the heart doctor, your primary care doctor, get the blood work, it takes about 3 months to get all that done. Some insurances require that you see the dietitian for 6 months. And so if your insurance requires that you have to take 6 months to see the dietitian, then you're looking at probably 7 months till surgery. So usually it takes us about 2 weeks after you get all your clearances done to hear back from your insurance whether it's approved, and another 2 weeks to get you on the operating room schedule and get you on that diet to prepare for surgery. Another question is, what preparation is needed in connection with COVID? Well, for COVID, what we do is we get you tested to make sure that you're negative at the time of surgery. If you are positive, then we postpone your surgery until you're negative. The other thing that we do is about 10 to 14 days before surgery, we ask that you social distance and self-isolate to make sure that you aren't going to be positive at the time of surgery. And during the 2 weeks after surgery, we ask that you do the same thing as well to prevent you from getting any risks or complications associated with COVID infection. A question is, I have Cushing's syndrome. What procedure would be best suited for me? I am 24. Well, I would say the gastric sleeve is probably the best surgery for you if you have Cushing's and you're 24. What are some of the psychological impacts of the surgery? Well, most of the psychological impacts are positive. Better self-esteem. You feel good about yourself. You are less anxious. You have less depression. As far as negative impacts, oftentimes when you lose weight, you forget that you actually are much smaller. So patients tell me things like, when they walk in a room, they still look for the big chair. When they go to the bathroom, they still look for the bigger stall. Those impacts take a long time for that to go away. But what you'll find is mostly positive psychological impacts as you lose the weight. How soon can you have a revision? Well, it all depends on why you're having a revision. Most of the time, people are able to lose the weight and keep it off. And as far as revision is concerned, we usually try to work with you first to help you use the tool that you have to lose the weight and get back into normal eating habits, normal pattern, and back to a good mindset. If you find that despite all this you can't lose weight, then we'll talk about revision. And it doesn't really matter as far as timing, it matters more how you've been doing as far as trying to get back on track before you get a revision. Another question is, what kind of post-surgery support is available, and will I stay in touch with my doctor? So here's the thing. Once we operate on you, you're stuck with us for life. We do want to follow you to make sure that you are successful. And if you're unsuccessful, we want to follow you and meet with you more frequently because we want to help you become successful. We want to help you get through this. We will not abandon you, okay? So if you are not doing well, and if you are too ashamed to come see us, don't be ashamed. Come see us so that we can help you get through this. As far as post-surgery support, we do have a dietitian that you could see as often as possible, as often as you need to kind of help you through this. We also have a psychologist that's available for you for behavioral modification, or if you have any issues after you lose weight. And then we as physicians, as well as our physician assistant, are always there for you. We are a phone call away. Now we're a telemed visit away. It makes it so easy to get an appointment and come in and visit with us and talk with us, because now we do have telemed as a tool. You don't even have to leave your living room. How long does the whole process take before surgery? It could take anywhere from, I would say, 3 to 7 months. If you're really slow in getting your clearances done, it could take you a year, year and a half. But hopefully, somewhere between 3 to 7 months. Another question is a specific fitness or diet routine needed to maintain the weight loss? So here's what I say about fitness and diet. So number one is, once you lose the weight, it's important that you eat right to maintain that weight loss. And what does eating right mean? So if you look at all the diets that are out there, what are the most successful diets? High protein, low carb is one of the most successful diets. Vegan diet is also one of the most successful diets. So what does that mean? So we ask that you eat wholesome, okay? Make good choices. Stop eating processed foods. Does that mean you'll never ever be allowed to eat a potato chip again? No. Does that mean you'll never allowed to eat a Pop-Tart again? No. That means make good choices most of the time. If these are things that you can't live without, then guess what? Eat a small amount here and there, but not all the time. Okay? You do have to maintain good eating habits. So what does that mean? Fresh fruit, fresh vegetables, and protein. Lean meats. You could do chicken. You could do eggs. You could do beans if you're a vegan. Whatever you enjoy doing, try to make healthy choices. What I usually say is, if you can't kill it or grow it, don't eat it. Okay? As far as fitness routine, there's not necessarily a real big fitness routine. I think walking is free. You don't have to join a gym. And nowadays, it also prevents you from catching COVID. So if you go outside and walk 20 minutes every day, that is good cardiovascular exercise. If you can't even walk 20 minutes a day, then do this. Walk 5 minutes a day, okay? And slowly work up to it. If you basically can only walk 5 minutes because your knees hurt and your back hurts, guess what? Then walk 5 minutes, but do it 4 times a day so that you're up to 20 minutes. So is there a specific routine? No. But there's different ways to maintain your diet as well as your fitness without going to any extreme. Another question is, how often does a patient need to follow up after surgery? Well, we have a routine. We follow you at 2 weeks after surgery. We follow you at 4 weeks after surgery. And then we follow you every 3 months for the first year. We do blood work at 6 months. We do blood work at 1 year. And then we also see you once a year forever after. And forever after, we do blood work at a year after each year after that. Basically, like I said, we follow you for life, so you're kind of stuck with us. If you don't like me, you could see one of my partners, Dr. Peters, Dr. Ergow, Dr. Singh, or you could even see our PA. Would you recommend a family member to have bariatric surgery? Actually, I would recommend me to have bariatric surgery because I have eating issues too. However, I don't meet the criteria, so absolutely I would recommend a family member to have weight loss surgery. And that looks like that's all the questions that we have. Okay. So this is CHRIAS Goes Live. I hope everyone has a good evening and hope this was informational for you. And if you are interested in surgery, give us a call. Thanks.